take a look at admissions, transfers, and discharges now. So when we're looking at admissions, discharges, it's what our role as a CNA is with this. We have to keep in mind that privacy and confidentiality is important for our residents. We've learned that this is a patient right. We've talked about this frequently throughout this class, but privacy, keeping their information private, make sure that we are talking about people in private settings, that we're not communicating information in places that other people can overhear that don't need to know the information. We've talked about reporting and recording. Reporting is the oral account of what's happening to a person. Recording is the written account, and they're both, that's always very important on admission and transfers. And understanding and communicating. Understanding and communicating with our residents, with our coworkers, very important to make sure the admission and transfer and discharge process goes smoothly. We always have to show respect for the person and the person's property, and being kind, courteous, and respectful is also key in this. So the admission process is going to start with the admitting office. So admission is the official entry of a person into that agency. So usually the person is going to go through the admitting office, or if the person isn't able to, they'll take them right to the room. Someone from the admitting office will come to them and verify their ID and their insurance and get their paperwork started. So that is always really critical. They're also going to be identifying information, verifying that the person is who they say they're going to be, and usually at this point the person will get an identification band put on them so we can verify their identity to their chart and stuff as well. During the admission process, admitting staff or a nurse is going to obtain that information for the admission record, and that person is given that ID bracelet. Now, at some facilities that we go to, we've mentioned that some of the residents don't like to wear the ID bracelets. Again, this is their home, and so if they aren't going to leave an ID bracelet on, what they do on admission is they take a picture of the person and put it in the corner of the chart, so that way people can always go to the chart and verify that they have the right person with that picture. Admitting papers and a general consent for treatment, that the person's agreeing to treatment, is signed by the person, and then the person walks or is transported to their room by a wheelchair or a stretcher. So before they come to that room, as the CNA, you're going to prepare that room for the person before they arrive. Generally, we're going to be getting height, weight, and vital signs so we can get all of that equipment in the room for them. We usually get a little admission kit or an admission packet that has toothpaste, toothbrush, a bath basin. We'll get a urinal for men, a bedpan for other patients if they need it. So that is pretty typical to get the room prepared. So when we admit the person, when the nurse usually greets and escorts the person to the room. So if the RN or the LVN is busy, you as the CNA would be doing this. And this is your opportunity to make a good impression. And remember, good impressions tend to stick for quite a while with people. You know, if you're like, oh, I'm too busy to do this, and you're short with them or not very friendly with them, that's going to be their first impression of the facility. And sometimes that's kind of hard to move forward from, okay, if you leave a bad one. So greet the person by name and title. Mr. or Mrs. such and such, my name's Kelly. I'm going to be your CNA today. What would you prefer to be called? How would you like to be addressed while you're here? So make roommate introductions, okay? Especially if they're going to have a roommate, they should know who the roommate is. So introduce them to the roommate. Act in a professional manner. Again, you're representing that facility where you're working. When you're in the nursing home during your clinical time, you're representing our college. And so we always expect you to act in a very professional manner, to represent us in a professional manner. You treat the person with dignity and with respect at all times. So during the admission procedure, generally we are going to be helping collect some of the information for the admission form. Now the RN generally does the admission form. They will do the initial assessment and the admission form, but they will probably ask you to get the height and the weight. So we learned in one of our previous classes on how to use the scale, how to do the height of a scale, so we can collect height and weight. We can measure the person's vital signs: temperature, pulse, respirations, blood pressure, check their pain level, and if they have any kind of respiratory issues, we would get an oxygen saturation as well. Some places might ask you to collect a urine specimen, and one of the reasons they do that is sometimes people come into the hospital and they don't even realize, that they have a urinary tract infection. And so, because they're not really having any pain or burning on urination. And so, if we don't test them for a urine specimen, and then a few days later it ends up really presenting full bore, then it's considered healthcare acquired. So some facilities will just do a urine specimen kind of routinely on admission, just to rule out, to make sure they don't have a urinary tract infection before they come. The other thing we're going to do as a CNA is we're going to complete a clothing and a personal belonging list. So we're going to keep track of everything the person is planning on keeping in the facility with them. Now again, this is going to be their home for a while. Some for a while if they're doing rehabilitation, some for potentially the rest of their life. And so we want them to feel like this is their home. We want them to have personal belongings, pictures, mementos, knickknacks, blankets, things that make it feel homey to them. But we want to make sure that we have a list of them, so when they do go home, we make sure that we get everything back to them. And then we want to orient the person. We want to show them the nurse's station, where the activities room is, where the dining room is. We want to show them how their room works, how the call bell works, how their bed works, bathroom, where supplies are kept, things like that. We always want to make sure we do that for the person so they'll feel more at home there. Now, some facilities, hospitals in general, will have a hospital room patient board. And it'll say today's date, it'll have their room number, it'll say the nurse can fill in their name, the CNA can fill in their name, there's pain level scales on it. There's just some information that it's big, it's easy for the person to see. Just as a reminder, sometimes people wake up and they're a little confused as to where they're at. So we don't always see these in all nursing homes, but you do tend to see them in the hospitals. As far as measuring height and weight, so it can be measured on admission to the agency, and as far as the weights go, we've got the standing scales that we showed you. There is wheelchair scales. There are bed scales. There are lift scales where the lifts, when the lift lifts them up, it actually has a built-in weight measurement to it. Some facilities even have bed scales, scale built into the bed itself. So generally when we weigh a person, the person would wear a gown or pajamas. We let them empty their bladder. We try to weigh them at the same time of the day each day, and we try to use the same scale for daily, weekly, or monthly weights. So usually a person is weighed on admission, and then usually once a week for the first month or so to make sure their weight is staying stable, that they're eating okay. And then if everything seems to be okay, then usually once a month. So usually you'll find most of the residents get weighed once a month. Now this might be different if you get a job as a CNA in a hospital. If it's a cardiac patient and they're concerned that the person is retaining too much fluid in their body, they might actually weigh the person every day. And we usually do it first thing in the morning before they eat. So we start with the scale balanced to 0 before we weigh the person. Now normally this says that they would only wear a gown or pajamas, but if you do happen to get weight as a skill for state competency, you are going to put their shoes on, you are going to walk them over, the clothing's going to be on, shoes are going to be on. Even though that may not be how we normally routinely do it at the facilities, that is how you will do it for state competency. So this is the scale. There are some scales that have just pounds on one side and the kilos on the other side. This particular scale has kilos down here on the bottom in black, pounds here in gray. And you have to be really careful with these, because here, for instance, it's not the number you see right here, it's where the arrow is pointing right here, and this would be at 80 kilos. If it was pointing right there, it would be 150 pounds. But the one that gets really tricky is sometimes when that arrow is right here on it's on the 40 kilo mark, but this 100 sits perfectly right here in this window, so people think they're on 100 pounds when they're actually on 40 kilos. So if you weigh a person, it's okay to weigh them in pounds, it's okay to weigh them in kilograms, so long as you're all on kilos and all on pounds. You can't be on the kilos down here and the pounds section up here. Your weight will be totally off. So, and then up here, when we look at these, so each one of these lines, so here's 14, and this says 16, so this big or dark one here in the middle would be 15, and then each one of these little tiny lines is a quarter of a pound. So this would be 14 and a quarter, 14 and a half, 14 and 3/4, 15. 15 and a quarter, 15 and a half, 15 and 3/4, 16. So you're going to add how many pounds from here and how many pounds up here, and that will get your weight for you. And we will be helping you with this in the clinical setting. We'll show you on the scales in the clinical setting how to actually do these weights. As far as height goes, I was always taught to let them back into it so this doesn't accidentally drop and hit their nose. But whether you're going forward or backwards, you're going to let this bar rest lightly up on their head, and then you're going to read it down here on the scale. It'll actually say read here, and it'll show you how many feet you're at and then how many inches you've come down. If you have a person who can't stand, so let's say you need a height and the person cannot stand, then we can actually measure them in bed. So we would put a flat, like a ruler or something flat from the top of their head and just come on over here, and then we can just run that ruler or that tape measure from the head all the way down to the heel, and we can get their height that way as well. Military time we've talked about repeatedly on admission forms, on our nursing records. We're going to use military time. That way there's no confusion whether we're talking about, if it's at 1 o'clock, if we chart 1 o'clock, is it 1 o'clock in the morning, is it 1 o'clock in the afternoon? Military time is going to stop any confusion. So remember our military time, it's 4 digits, no semicolons, no AM, no PM. So 4 o'clock here in the afternoon would be 1600, or 4 o'clock in the morning would be 0400. Now 2400 is our last time, that is the upper limit of the time. So when it's 5 minutes past midnight, it's 0005. Now transferring a person, if we have to transfer the person to another room. So sometimes we move a patient from one room to another. Sometimes we have to transfer the patient from their room back to the hospital for a procedure, and then they get transferred back. So it can be a change in condition. It can be because the person wants a change of roommate. The roommates maybe don't get along. Changes in care needs, especially like right now with this COVID-19 outbreak. We have different zones, a green zone for people that are not positive, a yellow zone for people that are maybe been exposed but not showing any symptoms, and then a red zone for people that are actually have the COVID-19 disease. So people can get moved from one section to another section depending on their care needs that are going on or the change in condition. As far as roommates, when we admit a person into a room, so we have an empty female room, but those two people just don't get along. That's going to be miserable for both of them. So as soon as another room will open up, we might move them one of them to another room. So we try to accommodate people's requests as much as we possibly can. We want people to be happy where they're staying. So and that can be difficult if you really don't care for your roommate for some reason. So the doctor, the nurse, or the social worker will explain the reasons for the transfer. That is not the CNA's responsibility, but you're going to assist with the transfer. You're going to get the person the wheelchair, the stretcher, the bed, or however you're transporting them, and you're going to need to make sure you gather all their belongings up to take it with them. So if they're transferring to another room, we're going to gather up all their supplies, all their belongings, pack it all up, take it to the new room, unpack it, okay, and then help bring the person over there in their wheelchair or however they would normally get, transport from one area to another, and then introduce them to the new roommate, if there's different staff taking care of them because they're over in a different section, who the new staff would be. And so, we want to avoid pat answers. Oh, everything's going to be okay. We don't know what's going to happen or what's going on with them, but use touch to provide comfort. Always make sure we introduce the person to new staff and new roommates, and always wish the person well as you leave them. Now, discharge hopefully is a happy thing. So, discharge is the official departure of a person from an agency, and the doctor has to write an order for a discharge before the person can leave. If the person wants to leave the agency without the doctor's permission, it's called AMA, against medical advice. Now, if a person has dementia and they have poor cognitive function, they're not allowed to leave AMA. We can physically keep them at the facility. We can keep them from leaving. But if a person has cognitive function, people have choices, and they can refuse to be cared for at the facility. But they have to understand what it means. So when a person says, I'm leaving, I don't care what the doctor says, I can't stand this place, I'm out of here, the nurse will explain, that it's a risk for them to leave. Social services will explain how it's going to impact their benefits, because if they go into a nursing home and then they refuse to be treated there, then and they go home, then a lot of times their insurance won't pay for it again until after a certain length of time goes by. So then they're stuck, and so they have to understand that before they go. So when a person wants to leave against medical advice, always make sure you tell the nurse right away, because they're going to come in and explain the potential risks to them health-wise, explain the potential risks as far as benefits go, and then the nurse will also notify the physician and let them know what's going on. Now, hopefully, the reason our patient's getting discharged is because they're better and they're getting ready to go home. So we would always want to know what time that they're planning on going home, when the person might actually leave the facility, and if they're going to leave by wheelchair, or if the ambulance is picking them up and taking them back home, or how they're planning on getting home. So if the nurse tells you, Mr. Smith is going to be discharged today around 11 o'clock, that doesn't mean at 11 o'clock you start thinking about getting everything ready. That means by 10:45, they should be bathed, they should be dressed, all their belongings should be gathered up. You've gone through that belonging list that we took when they were admitted, and gone through and make sure that we're giving everything back to them. And so they are completely ready to go at that designated time. So that's always something that we want to make sure that we're doing for them. And that is admissions, transfers, and discharges.